Welcome to Ultimate Aesthetics. We're very excited today to show you the latest technology at our clinic. It's a revolutionary way in treating urinary incontinence, which affects millions of people in some way, big or small, and all just by sitting on a chair. We have Dr. Carolyn Choi, the founder of Ultimate Aesthetics here, and as well as Karen here today, who will be explaining to us how EMSELLA works. So Dr. Choi, can you tell us how does the EMSELLA work and how does a chair help urinary incontinence?
Well, what we have here is a new revolutionary procedure which essentially uses electromagnetic waves to stimulate the pelvic floor. So in this actual treatment, the electromagnetic waves actually cause a contraction of the pelvic floor muscles over 11,000 times. So that's the equivalent of doing 11,000 Kegel exercises in a 30-minute session, which is more contractions than one could possibly do in that time period. The other great thing about it is both TGA and FDA approved.
Wow, 11,000. That's a whole lifetime of Kegel exercises for me. So Karen, you've been sitting there for a while now. Can you tell us a little bit about how you're feeling? The contractions from the chair must be quite strong. Does it hurt at all?
Definitely not uncomfortable, doesn't hurt at all. I do feel some pelvic floor contractions and some tapping sensation, but it's definitely something I could sit here for 30 minutes.
So Dr. Choi, can you tell us a little bit more about what does this procedure actually treat and how does the chair actually work?
Well, what we do know is urinary incontinence actually affects over 200 million people in the world. Now, urinary incontinence, there are actually many different types and different causes of urinary incontinence, and they include things like being overweight, childbirth, pregnancy, surgery, and they can all cause a form or type of urinary incontinence. And we also do note that as we get older, it also tends to get a little bit more severe as well.
So how do we know if we suffer from incontinence?
Well, actually, there's two different types of incontinence. One's actually called stress incontinence. Now, stress incontinence happens when you jump, sneeze, or cough, and you leak just that little bit of urine. The other type that we call is called urge incontinence. That happens when you feel the sudden urge or need to go to the toilet, and you just somehow can't make it in time, and you leak a bit. Unfortunately, some people actually suffer from a combination of the two.
So what's the treatment regime like?
Well, we often recommend that the patient should have at least 6 treatments spaced out over 3 to 4 weeks. So that equates to about having 2 treatments done once a week. And the reason we recommend that, it is important to really strengthen up that pelvic floor to get it really good and strong. Thereafter, we do recommend to have a maintenance treatment only once, maybe every 3 to 4 months.
Wow, so this is like gym workout for your pelvic floor. So is everyone able to use this machine?
Well, this is a medical device, so before anybody actually has a treatment, it is important that they have a consultation with our medical doctors where a full comprehensive medical history is actually taken off the patient, and then after that we will determine whether or not they are eligible for treatment.
So Karen, you've had 5 treatments now and this is the last one of the 6 that is recommended. How do you feel?
Well, I can really see the difference how I can control my bladder. I've got more confidence to do things that I normally wouldn't have done. I get a great night's sleep without interruption, but I never thought that I could have a treatment that was so easy yet so effective.
So thank you Dr. Choi and Karen for coming in today to tell us a bit about the EMSELLA. And there you have it. If you're interested in finding out more about our EMSELLA treatment, you can log on to our website, which will be on the details below, or you can contact us for a free consultation.